let's see. So your chief complaint you're dealing with is your hip pain. Is that correct, sir? Okay. And what else is bothering you at this time?
Neck.
Okay, so we got the neck issues. And I believe you mentioned about something with the shoulders as well. Is that correct?
Correct.
All right, so now we got neck, shoulders, lower back. Okay, so with the hip, is that pain? Do you ever notice any troubles with sitting, standing, walking?
Running and sitting for long periods of time.
Got it. Okay, so let's have you walk down. Put your hands on mine. Okay, go ahead. March in place. Knee at the waist level. Okay, stop right there. Go ahead. March just right. Just the left. Just the right. See what he's doing, guys? It's interesting. How does it feel like when you try to raise your right leg?
Not much balance.
Correct. So it looks like he's like trying to compensate, but it's like struggling to try to raise that right leg. There's a considerable imbalance. Now, what I'm seeing on the Gillet's exam is that everything on the PSIS, it's moving just fine on the left, but on the right, it's just jammed and it's stuck, not moving too well. When I check down here on the PIIS, it's actually moving just fine over here. So he has a PI misalignment over here. So when I go over your history, right, and also going over your gait analysis and the x-rays over here, some things that stand out right off the bat. Okay. A normal angle for this sacrum over here should be 45-degree angle. Okay. But instead, it's very anterior. Now, according to the textbook, okay, it clearly states that whenever the sacrum goes anterior like that, then I want to investigate where is the potential PI or EX or PIEX misalignment. All right. That means the hip itself either went backwards like this or it rotated this way, okay? Now, seeing over here, I don't see too much rotation except when I compare the widths over here, okay? This is slightly narrow, and same thing with this. The width over here is slightly narrow compared to this. But this gluteal fold line is pretty much centered. So now we're gonna take a closer look at other things as well. When we take a look at the height of this, okay? It shows also they're almost symmetrical. So we got something funny and odd things going on over here. So nothing really stands out. So on the Gillet's test, it confirms on us that now you do have only a PI misalignment. So that means your right hip, it went backwards like this. Okay, there's no rotation. Now, the more bigger picture is that, okay, the rest of your spine, because this thing went backwards, all right, your body, and also it created a very short leg on the right-hand side, okay? So your pelvis got tilted this way. Now, because it went, instead of from a straight upright posture over here, it went out like this, and so your fourth lumbar vertebrae, it tilted this direction, right? Now what I like to see ideally is it rotates this way. But no, your body counter-rotated in opposite direction, right? Now that's not a normal transition over there, because part of it is because of that significant tilting you have towards the right-hand side. So we're seeing that transfer of load going, meandering from to the right, to the left, to the right, left, right, left, right, left, all straight to the top. And because of so much of that steady rotation going on with your body going like this way over here, this way over here, this way, this way, and that way. It's also tilting your jaw out of alignment as well. The mandible, right, the mentalis, right, the center part of the jaw should be here. But you see it went all the way to the left. So that partly explains why you have that TMJ going on as well. All right. Now, the bigger picture, what we're going to do is this. we need to address this one over here because it also causes hyperarching of the lumbar spine. There's a hyperlordosis. It shouldn't be this badly arced. Normal, see over here, we do a plumb line, okay? It should be lining up over here. It went way backwards. So you're doing a nice little fun lumbar over here, okay? And we can't walk this way either. So that's how your body starts recompensating and going like this way. Now, usually with this kind of huge arc, I like to see a more significant compensating over here. Interesting enough, your body didn't do that, okay? It's assuming a little more normal angulation. It's a little shallow than I like it to be. I like to have a little more normal over here, but it went a little shallow instead. So it's an interesting, the compensation to address with this hyperlordosis, and this one will become hypokyphotic. In other words, it went a little more shallow. And that's what caused, as a defense mechanism in your neck, to go slightly reversed. Because it doesn't like dealing with all the significant rotation twists like this, okay? So just like a spinal circuit breaker, okay, it'll trip. It'll try to protect the nerves, the brainstem, and your brain itself by going reverse curvature here. So instead, you want to address the cervical neck during a consultation, but the real answer is no. We actually got to win down here. Because if you're all twisted up like this, okay, how can we address here if the problem is all the way down at the pelvis? So we're going to address down here first. Now we uncovered that this is the right PI ilium over here, okay? How do we address this, right? Now, there's two ways to correct this misalignment. Either we could do a push maneuver or we could do a pull maneuver. Now, because the way the lumbar spine is, everything is rotated towards body right, spine is left over here. If we do a pull maneuver, it's going to make the whole entire spine even more this direction. That's something what we want to avoid, okay? Because we don't want to make you more twisted up. You're not going to like it. So that's what we're going to do, a push maneuver to try to realign it and also knock two birds with one stone over here. Okay, so with instrumentation over here, we're looking for signs of that inflammatory process. Now, when the tissue gets damaged, right, it's going to increase the vascular supply into the area to try to bring in more white blood cells to repair the damaged area. Now, the byproduct of that increased vascular supply is going to be more heat. And that's what this device over here picks up. So, we're looking for any other indicators. And this also, the instrument over here, helps us narrow things down for the potential culprits. So we got the swelling over here. How's this, sir? Tender?
Yeah.
Yeah. How's here?
Less tender.
Less tender. Here? Not too bad? Yeah. Not too bad. Yeah, just remember, that's that brick wall. This fourth lumbar. Somewhat fixated. That's compensating because we also did not see any heat reading in that level either. How's this, sir?
Does it move very much?
No, it's not. Now, I'm going to keep an eye on this because it's not fully fixated. Okay. That's what the potential issues are. Right there. Okay. There you go. Come on up. Okay. Walk around. All right, sir. Tell me, what's different with the hip?
Feels looser.
Mm-hmm.
My steps aren't as short.
Good.
And walking better.
Okay, go ahead, put your hands on mine. Go ahead, mark in place. How's it feeling now?
Much better. More balance.
More balance. Okay. So, now the reason why I talk about balance is because, again, when there is a posterior inferior misalignment of the hip over here, what it does is it causes the whole entire side to sink down. So by addressing that, realigning it, that's what causes it to become more level from here to this direction over here, right? In addition to, when it starts to go more inferiorwards, when it starts to go tilted this way, it's also going to change the Q angle a bit. It's going to make them slightly toward this way. And EX misalignment will make it even more pronounced. But because he didn't really have an EX misalignment, that's why it was very subtle and not much of a Q angle change over there. Okay. Go ahead, touch your shoulders. See how the shoulders are doing.
Popping and cracking.
Okay. Oh, there's a piece. Relax, a little more, a little. Okay. Now, as we see over here, guys, there's a lot of wing effect over here. Now, the reason why it's doing that is because there's not enough nerve flow from the lower cervical nerves that goes down to supraspinatus nerve and into this region over here to supply nerve function for the rhomboids, subscapularis, so on and so forth. So, yeah, that's an issue. Okay, come on up. AC's jammed up a bit. Now, as your viewers can see over here, now because we restored the nerve function over here, his scapula is not winging as much. You see this now? This rhomboid is actually engaging. Okay, now we still have some issues with the subscapularis muscles not fully engaged down here. But now that's going to take some time to restore more nerve function over here. Give that right shoulder a try. See if you like it.
A lot better, actually. Not as much popping or cracking.
Yeah.
More flow, I guess.
Pretty neat, huh?
Yeah.
As we uncovered, you had a problem over here, all right? You had a problem over here, and you also had a problem here and a problem over here, right? Now, by addressing that one over there, that is what's restoring the nerve function down into your shoulder blade itself. And as the viewer saw, pre and post adjustments, you had that ringing of the scapula over here. But now, because we basically improved it from here, where there's like very slow and not enough nerve function into that muscle, we freed it up, and then in effect, we reduced the traffic jams to try to get some more traffic into that shoulder blade and into those muscles. That's why shoulder becomes more stable, you have that less cracking, and so on and so forth, right? The reason why it cracks is because the ligaments and the muscles requires nerve function to hold the joints together. Normal, okay, when the nerves are working fine, right, the ligaments and muscles, it'll keep the two joints, one bone here, another bone over here, nice and taut, nice and firm like this. But however, if there's some kind of traffic jam in the way, what we call a subluxation, not enough nerve flowing going into the ligaments and muscles, it's going to be like this. So what do you think the bone's going to do? It's going to move a lot more. That explains why. So whenever on the future you notice, hey, what is it? What's going on over here? It's starting to crack again. That's how you know the nerve function in your neck is becoming compromised once again. All right? Okay, that's what the story is, sir. All right?